as your healthcare consultant, and I just got done reading this article, and it breaks my heart as a registered nurse and as a licensed nurse home administrator. And the title reads, RN and insulin killing case charged in 17 other nursing home deaths. She is charged with 2 new counts of first-degree murder, 17 counts of attempted murder, and 19 counts of a neglect of care. As a nurse home administrator, registered nurse, healthcare executive, this has to stop. And I don't know the particulars of the case to know where things went wrong and where things went left. What I do know as a healthcare executive is, as executives, we can do things such as root cause analysis when we have sentinel events in our facilities, or we have events that we should not have or we unexpectedly have in our facility. We can get down to why these patients are having the outcomes that they are displaying, or why our outcomes are suddenly dropping or changing. And I challenge every nursing home administrator, every nursing home executive, every nursing home DON to utilize the root cause analysis process when you have issues that are just out of the norm. Let's get down to why things are happening. Could these deaths have been prevented? I don't know. But what I do know that if we use the RCA process, we couple it with the PDSA process, and we encompass it in the QAPI process, we can prevent a lot of poor patient outcomes, and we can improve the quality of care that we deliver to our patients. So my message is simple to the healthcare executives out there. Let's utilize QAPI. Let's really do QAPI, not make them paper meetings, and we know what we're talking about. Let's dive deep into the RCA process, and let's really, really tackle the issues that people don't want to talk about. I can't tell you how many nursing homes I walk into, and they're implementing interventions to, as they say, better patient care, but they don't have any data to support it. Any interventions that we implement as a healthcare executive, DON, administrator, hospital executive, should be backed by evidence. It can't be, oh, I've heard about it, I've tried it somewhere else. Where's the evidence to support that it will work in this facility, this hospital, and this will improve the lives of the patients that we serve? Because we all know what works in Michigan is not the same thing that's going to work in California. It's definitely not the same thing that's going to work in Florida. So we have to tailor our interventions to the patients, the populations that we're serving. And we only do that by doing root cause analysis to find out what was the root cause of the issue that we're examining, and then we address that with patient-centered interventions. I'm sorry I had to get on the soapbox. This right here hurts my heart.